All right. In here with the good doctor this morning with Meharry Medical College. And listen, man, we're noticing that a lot of the ladies are calling up here.
Yeah.
And it's Men's Health Month.
They calling for their men.
It sounds a lot like my clinic, right?
Yeah.
It's more ladies. And to your point, Sissy, the women come in for their husbands. They advocate for their husbands.
Mm-hmm.
My male patients who have wives do better. So this is my shout out. They're stubborn. You're right. But this is my shout out to the guys who don't fit those categories. If you're listening out here, you don't have a primary care doctor. You've been scared of the doctor. Nothing to be scared of. If you have a disease, it's there. Whether you know it's there or not, you might as well deal with it. I sound like the Everest College commercial.
Wow.
Be like, you
Yeah.
might as well.
Deal
You ain't
with
doing
it.
nothing else, right?
Come on in.
Come on in. So, but to the brothers out here, get you a primary care doctor. Get checked up. Most of the time, there's nothing going on, and that's great. And then we don't have to see you, but once every year or so. And just check in, look at those numbers. It's like you would take your car to get a tune-up, right? You know, if you out here, you driving a nice vehicle, you're going to take your car to get your oil change. Why wouldn't you take your body to get the oil change?
That's right.
You know what I mean? Come holler at a doctor. Come see somebody, you know. I know it's loopholes. You got to jump through. You got to wait a long time to see the doctor. You got to see about 4 or 5 people before you see the doctor.
Right.
You know. And
You
those
gotta
are,
do that
those
everywhere.
are the
That's the
opportunity
frustration,
costs, right?
Yeah.
That's that, and I feel that frustration because I too am a patient. You know what I mean? Like I'm not just a doctor; I'm a patient. I'm a bad patient to that point.
Oh, I can imagine.
But I feel those pains. Nonetheless, it's not going to stop what's going on with your body. And so, are you going to let those things cause you to have an early death, or are you going to actually come in to see a doctor? I advocate very strongly: come in and see a doctor, guys. If you're a man, you haven't been to the doctor in 5 years, make that appointment today.
Please. I got one question before you go. What are your quick thoughts on Ozempic?
My quick thoughts on Ozempic is so far appearing to be a very good drug to use, especially for weight loss. Now, it does bring the blood sugars down too. It has a fantastic amount of weight loss. Most of that weight loss comes from just decreasing the appetite. People aren't hungry anymore because it slows down all that bowel transit and it becomes uncomfortable for you to eat a lot. That's what it really does. It makes it uncomfortable for you to eat a lot. Though that being said, those drugs tend to work pretty well, except for if you had some thyroid problems or if you've had a lot of pancreatic problems like pancreatitis. So if you've had those things happen, you need to check with your doctor first before asking for those medications. But yeah, I try to prescribe them. The problem is that a lot of the Lululemon chicks out there are getting it and my diabetics can't.
See?
You know what I mean?
Now, here they are sick and need the medicine, and you out here trying to lose weight.
But what is a Lululemon? I need to know exactly the definition before I start to use it because
So
I like
when
that.
Kenny first jumped on and he started talking about a certain, bad, I'm not going to say what he said.
Butch
But
body.
those young ladies.
Oh, okay.
All right.
Yeah,
There you go.
But we got to make sure we understand this. Even though people are on Ozempic and it's a medically prescribed drug, the importance of still being active and working out is still important in this situation.
There is no substitute for changing your diet and for exercising.
Wow, look at that.
No substitute.
No substitute for that.
None.
These drugs will cause you to lose some weight, but as soon as you get off that drug, guess what's going to happen? Boom. It's going to rebound, and it might be even more.
All right, guys.
615-341-4397. That is where Dr. Smith is.
That's right.
And he has three other locations, MMG, Skyline, and Total Health and Dental Clinic.
That's right. That's right.
All right, guys. And on YouTube right now, we're going to be on YouTube until 8 o'clock. So if you were calling in and you still want to try to get that done, hit us up on YouTube right now at 92Q Nashville. Give a round of applause for the good doctor, Dr. Smith.
Thank you so much.
Thank you. Asking the expert.
And the bros.
92Q, good morning. Ask the expert.
Yes, I was listening to the doctor talk about the new medication that he's talking about.
Uh-huh.
I want to know, what did he think about the larstatin and amlodipine mixed together?
Okay. So sounds like she's done some research. So the lovastatin and amlodipine together, those are two separate drugs. Amlodipine is a drug that treats blood pressure. It's a high blood pressure medication. It's a calcium channel blocker. Atorvastatin is a cholesterol medication. Now, for diabetics, we really like to go ahead and start a cholesterol medication, not just because of the treatment of cholesterol, but it also works on inflammation. And when you have chronic diseases like diabetes, you have a lot of inflammation. And we found that those medications, particularly atorvastatin, rosuvastatin, pravastatin, work very well to decrease that inflammation and decrease your risk of having a heart attack, which is the end goal. We want to decrease your risk of having a heart attack, right? The biggest risk of having a heart attack is high blood pressure. Second biggest is diabetes. Third biggest is hypercholesterolemia, okay? So we try to attack all three of those things if we can. Now, I am not certain about the combination of atorvastatin and amlodipine, but I am certain about the combination of atorvastatin and simvastatin and amlodipine have a bad interaction. They don't get along well. So if I have a patient that takes those two medications together, I usually try to take them off of the simvastatin and start atorvastatin. To my knowledge, and what I know right now, and all these things are subject to change because I'm studying every day. Even though I'm done with school, I still read my journals and things like that to stay current. Okay. But to my knowledge, atorvastatin and amlodipine get along just fine and are a good medication combination, especially for those who have high blood pressure and diabetes, to try to prevent. And again, the main goal is to prevent a heart attack or a stroke.
All right. Does that answer your question?
Yeah, so I'm asking, do you write larstatin and amlodipine together?
It's case by case, but most of the time, yes, I do.
Okay.
All right. Thank you.
Thank you.
All right now. 92Q, go ahead and ask the expert.
Hey, good morning.
Good morning,
I want
sir.
to talk to him how he was talking about the Ozempic. My primary care doctor has me on it because I was classified a type 2 diabetic, and it has brought my A1C from a 6.9 down to a 6. It works great. But he also told me I haven't experienced the weight loss yet. I've only been on it about 3 months. But he did tell me when you start losing weight, like you and Sean said, he said keep your exercising up because half of that weight you're losing muscle as well as fat, and to watch your diet. So I was just wondering, has the doctor heard anything about the weight loss part of it? My doctor's telling me you will lose muscle mass as well as fat.
Yep, that's true. That's true. That is true. And I've seen most of my patients that are on these medications do lose weight almost immediately. So I'm surprised to hear that you hadn't really lost the weight. But like to your point, the main reason why these drugs are on the market is the A1C. So congratulations to you. You should be commended getting it down to a 6.0. Yeah, man.
Right,
You're killing it. You got a good doctor, it sounds like. So
he's a great doctor.
Yeah. So I would tell you to continue to, the medication is working. It's doing what it's supposed to do. But to your point that you made, you got to continue to make those other sustainable changes because ideally, I mean, it's a shot with Ozempic, right? People don't know that. It's a shot, a once weekly shot. And so, some people are scared of shots. Right. Exactly.
I took mine this morning.
No one told me that. I thought it was a pill.
Yeah,
No,
right.
it's a shot, little butterfly needle.
So, if you're scared of shots, that's an incentive
And
right
you do
there.
it yourself?
You do it yourself.
I do mine in my stomach.
Yeah, I know a couple people that I have been known to take a phone call and encourage a person or two to go ahead and take that shot. Yeah, but it's, like if you are scared of needles and all those kind of things, like if you have poorly controlled diabetes, you're going to have a lot of needles in your life. So, if you need some incentive to stay away from that sugar, having needles for the rest of your life, insulin, blood sugar checks, you know what I mean? Like that's not fun. It's not, it's an inconvenience to your lifestyle. It's an inconvenience to your lifestyle. So why not hit it on the front end?
There you go.
All right, bro.
Thank you.
Good luck on your journey, man.
Good
Keep
luck.
it getting down. Then when you call back, it's going to be 5.
Hey.
Oh, yeah, for sure.
My man.
So, I have another question.
Okay.
This is from our text message. Someone texted us and wanted to know if you could explain pre-diabetes and borderline diabetes, which you did.
Yeah.
But type 1 and 2 diabetes, and does diabetes cause your skin to itch? Maybe perhaps diabetes causes skin problems?
Okay. All right. So there's a lot to unpack there. Let's start with the differences between type 1 and type 2. The type 1 diabetics are the people that get diabetes very early in life, and those are people that don't have the cells in their pancreas that produce insulin. They don't have the beta islet cells is what they're called. They don't have those cells to produce insulin, and so they can't control their sugars. And so they usually present to a doctor at a very young age, 8, 9, sometimes even younger than that. with severe diabetes symptoms. Okay. Type 2 diabetes is what we used to call it like adult onset diabetes, non-insulin dependent diabetes. These people produce insulin. Their pancreas is doing what it's supposed to do. They may produce it at a lower level, but the bigger problem is that the cells around the body don't respond to the insulin the way they're supposed to. It's insulin resistance. So it's not letting insulin into the club. Say, hey, we got enough of y'all, because you haven't been exercising. We got all this sugar left over from the other day. Why are you bringing me more? Right? And so the body becomes resistant to that insulin. And then as a result, you then start to have high circulating levels of sugar because that insulin can't do its job. Right? And eventually the body says, hey, well, we got all this insulin out here with sugar not doing anything. We're going to cut that job off. And it stops making the insulin. So then they become insulin dependent. Right? But so type 1, type 2, type 1 people are born with it. That is very closely linked to genetics. Not to say everybody has a genetic version of type 1, but most people do, and they're born with it. Type 2 is more of an acquired from lack of activity, obesity, things like that.
I don't know who this is. He said, shout out to Dr. Smith. He's really out here blessing and informing our community. He even assisted my mother with some primary care needs, Stephen Williams.
Hey, yes, this is my good brother. Hey, Stephen.
Sorry.
I met him playing Pokemon, honestly enough. Like,
No way.
Pokemon.
All right, no, but his good brother, his wife works at Meharry with me as well, Dr. Tiffany Turner. So shout out to them.
See?
Pokemon.
Oh yeah,
Mom.
level 15, level 50, Dr. Killer Cow.
Oh, I had a question too. Hold on.
Hit me, Crystal.
They said, what about metformin is causing neuropathy?
So metformin does not cause neuropathy. I'm gonna go on record and say that.
Okay.
Metformin does not cause neuropathy. Metformin, or if you got neuropathy, we need to consider some other things, and the metformin is coincidental to that. Okay. What we know about metformin for a fact is that, again, it can cause that loose stool, that diarrhea. Let's call it what it is.
Right.
It can cause the diarrhea. And that if you have kidney problems, it can cause you to have what we call lactic acidosis, where you have too much acid in your blood. And you don't want that. So, but as far as neuropathy and metformin, I've not seen anything validated in literature to prove that. But, again, I'm glad to help investigate it for patients. And if it is one of the things, then, if they come out and they say that metformin causes neuropathy, I'm sorry, I'm going to have to stop prescribing it. But I have not seen that.
Okay.